After 6 decades of practicing medicine, it's remarkable how many North Carolinians Dr. Hedrick has, let's face it, raised. But really, the other thing that's remarkable is that he managed to be an independent physician for 61 years. That's a wonderful thing for community when you have somebody who is unencumbered with dealing with hospitals or health systems and able to just focus on his patients and say, I'm here to take care of you.
I always told the patients I wanted to try to make them feel better and live longer. I wanted them to see me more as a friend who was a doctor rather than just a doctor. The patients seemed to like it, so I've been very pleased in practicing medicine for 61 years.
I remember going into Dr. Hedrick's office, and there was a big wall just full of files. Mine must have been a foot thick after being there so long, but it just made it more personal, seeing all the patients that he had over the years.
Avance Care is so privileged that Dr. Hedrick chose us to take care of his patient panel after he retires. We firmly believe in the independence of the primary care doctor, and Dr. Hedrick has been a primary care doctor who's been independent for over 60 years, just taking care of his patients without anyone else, hospital systems, health systems, telling him what to do.
I thought it was very important from the practice that I was going to refer patients to be able to look after the patients the same way I did, to care about them as individuals, and no matter who they were, where they came from, or so forth, or what problems that they had. So that was very important to me. And I'm very impressed with Dr. Gill and the way he handles patients and so forth. And the patients I've talked to who've been to him have been very pleased with Dr. Gill. So I think that's going to be a good fit.
I think we both see patient care similar. It's about relationships, and I've practiced that way for 30 years and do the same thing. So I think that goes over in our practice as well.